Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Hello everyone, I'm Aditi Gangar from Thip Media, and today we will be discussing urinary tract infection. It is also called as UTI. UTI has become common in women. Statistics shows that every 1 in 5 women will develop UTI once in their lifetime. But do you know that UTI affects men as well? However, the cases of UTI in men is lesser than women. Today, we have invited Dr. Anita Gupta to understand the basic aspects of UTI. Dr. Gupta is an experienced gynecologist who works at the Fortis La Femme hospital in Delhi. We will be asking Dr. Gupta about what UTI is, why it affects women more than men, what are its symptoms, and most importantly, what you should do if you are affected. Welcome, Dr. Gupta, to Thip Media's show Health Files. My first question to you is, what is urinary tract infection, or commonly known as UTI?
Thank you, Aditi. Thank you so much for calling on this webinar. So UTI, the full form is urinary tract infection. So as the name indicates, it's the infection of urine. So urinary tract means that it includes from the kidneys to the urethral opening. So the infection can be at any level, but generally it's the infection in the urine, so that you get the symptoms while you're passing urine, or at that area from where you pass urine, which we call the urethral opening. So basically it's the infection of the urine, or which can affect the urinary tract also, or it can just be localized to the opening also, or it could just be a symptomatic thing and there is actually no infection also at times. So if we discuss the causes, so obviously there has to be a infection, which is a bacterial infection, which will lead to changes in the overall urinary pattern, and that leads to the symptoms of urinary infection, which are like the most common are burning while you're passing urine, or you feel like going for the urination very frequently again and again, or when you go to pass urine, you're unable to pass the urine and you just pass few drops. So these are the usual symptoms which indicate that it could be a urinary tract infection.
Okay, ma'am. Ma'am, my next question is, what causes UTI, and is it a serious health condition?
So as I told, UTI is caused. Really, it is not a serious situation. UTI is very, very common in women, and usually treated with few days of antibiotics. But yes, if it involves your kidneys, then it's a very serious situation. So if the UTI doesn't, you don't recover with simple antibiotics, then of course we do a scan for the kidneys, or we do more investigations to see whether any other organ, like besides the urinary bladder, is the infection involving the kidneys also.
Okay, ma'am. Ma'am, my next question is, who are at a greater risk of developing UTI, and why UTI affects women more than men?
See, the people, let's say age-wise, let's go first age-wise. Very younger girls who have just, started their sexual activity, they are more prone to UTI. The reason is that there is a continuous friction on the urethral opening. And due to intercourse, sometimes the hygiene also gets affected. So in fact, patient which we call honeymoon cystitis, which is seen in newly married couples because of the sexual activity. Then in the age group, the women who are more than 65 years, means menopausal women, they are also more prone to UTI. Many times it's their health. Suppose they have a diabetes or any other illness which is reduced their immunity, then they get the UTI more the younger woman. So besides the age, again, as I told, it's your hygiene. If you are living in unhygienic conditions, or you are at a place where you don't have proper toilets, you're holding your urine for a longer time, or the toilets are very unhealthy, then also you are more prone to UTI. Thirdly, of course, if you are having any, as I told for the elders, similarly it applies to the middle-aged people also. If they have diabetes is one problem in which the UTI is comparatively very, very common. And of course, any other disease which has reduced your immunity, you tend to get the UTI more. Now you asked why women have it more. So see, the urethra is a very short urethra in women, and during sexual activity also the urethral opening is very much affected for the woman. Thirdly, the vagina is very close to the urethral opening. So if you have a vaginal infection, it can immediately affect your urethra also. So these are some factors because of which you have more UTI in women. And in elder women, the mucosa, which is the outermost lining of that area, starts getting little thinner and dry. That also leads to more UTI in the elder woman.
Okay, that's quite informative. Ma'am, my next question is how UTI is diagnosed?
Okay, so UTI diagnosis is first of all your symptoms. They are very much indicative that you have a UTI, but it is a actual infection or it's a non-infectious issue that we come to know by urinary infection, the urinary sampling testing for urine culture. So we do a urine culture wherein we see is any bacteria growing in this urine. If yes, then which type of bacteria. Then we also do a sensitivity test for those bacteria to see with which antibiotics these bacteria are sensitive, so that we can give the treatment accordingly. And we may at times need an ultrasound also to find out if the infection is in the kidneys also. So basically urinary infection and maybe an ultrasound may be needed. So that's how we find out whether it's a real UTI or not.
Okay, ma'am. Ma'am, once diagnosed, how UTI is treated specifically in Indian context? Also, I would like to know, does diet or lifestyle have a role to play in recovery from UTI?
Okay, so if we are diagnosed with UTI, which means you really have a bacterial infection. So see, the culture report comes in 48 hours. And if you are having a lot of symptoms, we have to give some treatment. So we don't the antibiotic till we give the urine sample. We give treatment for symptomatic relief. Symptomatic relief means that whatever symptom you are having, suppose you are having burning. Burning means that your urine is very much concentrated. So we give urinary alkalizers, which reduce make the pH of the urine in such a way that the burning is reduced. And feel that you are not taking enough water. Many times, the person is not taking enough water, then we suggest to increase the water. And sometimes we give painkillers also to give the relief. We usually give the antibiotics once we get the culture report, but at times the symptoms are so much that we start an antibiotic before we get the report. And let's say in the report, if we get that this particular bacteria was not sensitive to the antibiotic which we have started, then we can add on an antibiotic. So the basically the treatment is you're talking about diet. So we tell them to increase the liquid intake, which is mainly water, and take fruits which are good in antioxidants, like fruits and vegetables. So such food items, they always help in all diseases, so it will help in this also. And we give medicines to improve the pH of the urine and reduce the pain, and then finally antibiotics. That's the treatment.